catching a disease is a normal lifestyle change. Think of catching a flu. Think of developing a stomach ache. But with the coming in of the new and latest pandemic in the form of the coronavirus, it has been strange and fearsome news for most people. In Africa, for example, this is a disease that most people never thought would hit their doorsteps. In the next 30 minutes, we'll be sharing with you an interview that we had with Honorable Evangelist Haritatos.
I tested positive on my second time to test. At first, I'll be honest, I never expected to get a positive test back, and almost immediately doubted that I could have been positive. I had followed everything by the comma, by the full stop, and arrogantly thought it could never happen to me, which I'm sure a lot of our brothers and sisters in Zimbabwe also believe. But certainly it happened to me. And I had done 2 tests that week, one on a Monday and one on a Wednesday, and I found out on Thursday that I was positive, and then the second test that I had done, the results came the following day. So by the time I got my second positive, I knew for sure 100% that certainly I was positive.
Most health practitioners would tell you that fighting a disease starts in the mind. How did the Deputy Minister prepare his mind to fight off his condition?
I was a little bit angry that it could happen to me, but the major fear that I had wasn't so much about myself. I was very worried about the people around me and the people that I had interacted with prior to me finding out that I was positive. So you know, it was a bit of a difficult time in the sense that my worries that I could have hurt my children, my wife, my mother-in-law, my father, who's elderly, also is 76, my mother. My fears weren't really about myself and how I would pull through. My fears were mainly for those around me. And obviously, being a government minister, you come across a lot of people. The vice president, the president, other ministers. And so my fear was that I could have got them sick. Fortunately, and I don't know why this happened, no one in my family tested positive. So even though I had COVID for at least about 4 days before I found out that I was positive, not my wife, not my children, my mother-in-law, none of them tested positive. Well, almost immediately I went into isolation. So what I can tell you is that when I found out that our late minister passed away, when the president announced it on the Thursday, myself and my co-deputy minister, Honorable Karuru, we both decided that we would basically go into some form of self-quarantine or self-isolation so that we can protect our family and people around us. We had already got our minds ready for that after we found out the results. It changed a lot of things because, you know, I was appointed to provide a certain duty to our nation. And in some regards, I couldn't perform my duties for the 2 weeks that I was at home. And this actually, it frustrated me a little bit in the sense that we had just come off you know, a document that was just about to be launched by His Excellency, which is the Agriculture Recovery Plan, and I definitely wanted and desperately wanted to be part of that. And so from the government point of view, I felt that I maybe betrayed my government by getting sick. Of course, it happens, but in my head, that's what I was thinking. What was really also very difficult was the distance I had to now keep from my family. You know, I have a very young family. My eldest son is 13, my daughter's 10, and I have a little baby who's 2. And so while, you know, during the whole COVID thing, we educated our kids in understanding the 2 elder ones, I mean to say, and understanding what it is exactly, and should it happen, what it would mean as a family, what we'd have to do. So the first 2 were certainly prepared for the worst because we had educated them and told them that it could happen. But the little one, the 2-year-old, it was very difficult for him because, you know, he didn't understand. And he would always want to come to me, and my wife would have to pull him away. And so that was the very big challenge. But what I would do, though, is that I would make sure that every few days that I would tell my wife in advance let's take the kids outside and she would take the kids outside. I would put gloves on, socks, cover my face, most of my body, and I would walk outside in the open, fresh air with my mask on, obviously. I keep my distance from my kids, but be able to interact with them at that level, so that at least we did spend some good time, let's say. But certainly that was also difficult. I must say that the one good benefit that came from it was that I had a lot of time to myself. And I'm someone that, yes, I'm a government official, but we also run quite a lot of businesses in Zimbabwe. And I caught up a lot of work. It opened my head. I could actually now think a lot of things because, I had that spare time on my hands. And so I was pestering everyone that I could phone in our organizations to say, how far are you with this? Where are you with that? Where are my figures for that? Where are my stock figures? And I think I was on top of my emails. And, with my dual duties of government as well as private duties, it's very difficult to keep up to date because my priorities are my government duties. So a lot of people that are in my organization, they understand that the only time I can communicate with them is very late at night. So it was a bit of a different scenario where I was communicating with them during the day, throughout the day. So yeah, those are the things that were happening during that time.
The Honorable Deputy Minister was concerned that perhaps everyone in the family had caught the virus. But let's find out who else apart from him had contracted COVID-19 in his household.
Thank God, and very fortunately, I'm the only person in my family that was sick during the time that I was sick. Again, it's something that I can't understand, and I feared the worst, considering that when you're out in public, you take all measures to ensure that you're safe as well as keeping others safe. But when you get home, you're relaxed. I would take off my shoes, change. Still wash my hands, sanitize, but when the kids come, you're hugging them, you're kissing them, you're spending time as normal at home in your own environment. And so we were almost 100% certain that my whole family would get sick. And fortunately, and again I thank God for this, that not even one of them got sick.
Anxiety, the period between having your tests done and receiving the results. Did the minister manage this period? How did he do it?
Very unfortunately, my results did come too late. And I am a proud member of the National Task Force of COVID-19. And I raised this issue when I did test negative and I did return back to duty, that we really have to focus on minimizing the time lag between when tests are done and when we get our results. I'll give you an example. The test that I did the week before, which was a Wednesday, came out negative on Thursday, which was 24 hours. That's acceptable. I did a test on Monday, the following week, and because it was taking time and because the late minister passed away on Wednesday morning, I took the decision, since I hadn't had the results from the Monday test, to go and get tested again. And I got my results that I took on Wednesday, on Thursday evening, faster than the results on Monday. So the test I took on Monday, I only got the results on Friday. But the test I took on Wednesday, I got the results on Thursday. So certainly that time lag is a worrying time lag. I have raised it to the National Task Force, and what we've seen the last 2-3 weeks is that time lag has been significantly reduced. And so we will make sure as government that we push Ministry of Health as well as private labs to ensure that results do come out faster, because it's critical, especially if you're feeling you've got the symptoms, that to protect people around you especially, that you get your results quick so that you're not continuously meeting. I'm a public person, as you know. Again, we meet so many people, and I could have risked the lives of so many people, not only people coming to my office, but other senior government officials who we met in the course of that week. And so it would have been a great thing to have been given your results, within 24 hours, which could potentially save a lot of people. So again, I think as government, the last 3 weeks, we've done quite a lot to ensure that does happen. And so going forward, we can only get better.
COVID-19 presents itself through many symptoms. Flu-like symptoms, a cough, a headache, and in some cases, a stomach ache. What symptoms did the minister present?
My symptoms were very mild in terms of medical terms. I didn't go through what many people go through. What I can tell you is that when I did get sick, I felt that I had something evil in my body. I can't explain it because it's never happened before, but certainly I felt a third force within my body, which was very unpleasant. And when I did get better, I could almost feel that third force leaving my body. Very odd feeling indeed, but certainly this is how I felt. And during the course of when I was sick, my two main problems were very tight chest and a severe headache. I didn't have flu-like symptoms. Prior to my chest getting tight, I felt very weak. But during that course, I was regaining my strength. I was able to walk around even. And yeah, so that's what I had. It was very mild though, and unfortunate to have that. I read of a lot of cases where people are in extreme conditions, they can't breathe, and I was fortunate not to have that. But again, it doesn't mean because you have COVID that you can't walk, you can't move around. And I tried to balance, and that was part of me going outside, because I didn't want to just be stuck inside. I didn't want to be near people, certainly, but you need to have a positive set. Your mindset has to be in the right place. I believe on my side, 3/4 of my fight was my mind, to get my mind ready for the fight against COVID. And I had the support system around me. I had my family, I had friends, I had people from the ministry who continuously messaged me. Even journalists themselves were messaging me. And that's what helped me fight, in addition to everything else. But that's really the majority of the fight, is your mindset. And keeping positive and keeping that there is life after this. It's not that you're going to die, but fighting it. And we have very good numbers. We have about 80% recovery in our country, which is very encouraging. But the challenge is we do have 20%. And that 20% can be anybody. So the message is, don't be stupid. This thing is real. Protect yourself, protect everyone else. It can happen to you. If it does happen to you, be ready to fight, be positive, always keep positive, and you will fight it. But the point is, try and avoid it at all costs, because it can happen to anyone. To be honest with you, I felt that there's no way that I was going to die. I was very optimistic. I felt that I still had a national duty to perform. I still had so much. I'm only 34 years of age. I still had my whole life to live. So in my mind, I didn't really worry about myself. In my mind, I was worrying about my family. I was worrying about those that I came into contact with whilst I had it, without me having actually known that I was positive. And that's where my major worry was, that I'd hurt people around me, people that love me. To myself, like I said, I prayed a lot, but I knew that I was going to overcome this. I knew I was ready to fight it. I knew it. I knew that I could fight it. But again, I was very worried. I won't lie. I was very worried. My wife and my children, as well as my mother-in-law, had several tests to make sure that they weren't positive. And that was where my mind was thinking. I wasn't really thinking too much about myself.
One of the saddest moments, not only in the history of the ministry, but also the entire country of Zimbabwe, was the passing on of Honorable Parent Shiri, who succumbed to the coronavirus. How did the Deputy Minister, Honorable Haritatos, and those around him in the ministry manage to cope with this sad development?
His passing came as a huge shock. The week before we were together, he told me that he wasn't feeling well. And he had gone up and down to see his doctor. But you know, I didn't think that a few days later I'd be hearing that he had died. And it affected me quite considerably. I was very close with him. He was a very good man, very firm but very professional. And you know, it was 2 years of working with him really opened my eyes up to a lot. And yeah, his passing, it was, again, you know, we, even to today, you know, it's been I think about 2 months now, but it still shocks me that just the other day we were together in his office discussing the way forward and how agriculture and how we see agriculture and our story as Zimbabwe. So, you know, I got the call approximately 3:45, if not 4 o'clock in the morning. And I saw who was calling me. And I was just hoping that the minister delegated something to me, and that it was an early message to say, get up, get changed, you are required in Masvingo, for example. And I answered the phone, and immediately he said to me, I'm sorry to tell you, but the Honourable Minister has passed away. And you know, my body went cold. I went into complete shock because it was the last thing I was hoping to hear. The day before, the Tuesday in the afternoon, we had made some contact in terms of messaging, and he told me that he was actually feeling better. And so it was a great shock, and you know, such a great man, taught us a lot, and again, such a hard-working, you know, we were robbed by a hero, really. He didn't live the full course of his life. He still had so much in him, so much energy in him, and we could have had so much more from him. But this virus really robbed us of a great man.
What does the minister have to say to the rest of Zimbabweans with regards to how they can protect themselves from COVID-19?
My message to the Zimbabwean citizens and the people of Zimbabwe is that this thing is real. We mustn't be arrogant and think that it can't happen to you, because I don't think I was arrogant to think that it wasn't going to happen to me, but I never thought, you know, in some sense, that it could happen to me. This thing can happen to anyone. It happens to people on different social classes. You can be rich, you can be poor, you can be middle income, you can be white, you can be black, you can be a minister like myself, you can be a normal citizen. This thing is real. It can make you sick. It can kill you. And so the best thing is to follow what government is saying, follow the WHO guidelines in terms of social distancing, in terms of wearing your mask, in terms of washing your hands, and in terms of sanitizing. These guidelines are not set to punish anyone. These guidelines are set to protect the lives of everyone. And the thing is that you may get sick yourself, you may recover, but it's the people around you that you have to also be careful of, because people around you may not be so lucky. And the people around you can get to the extreme and maybe can pass away because of this COVID-19 virus. And so the best measure is to protect not only yourself, but to protect everyone around you and help the country, help the world stop the spread of this deadly and evil pandemic.
So there you have it. The reality is that COVID-19 is real, and it is here amongst us. The life and experiences of the Deputy Minister tell the story of a survivor, and all of us should remember the basics as being given by the WHO and the government. Stay healthy, stay safe.